So without further ado, let's just get it started. Now, Dr. Sai, you're up.
Good evening, everyone. My name is TJ Sai, and thanks for the introduction. And we're really fortunate to have Dr. Lee, who is also going to be speaking after me, but they basically have 3 years ahead of us in experience. So I'm really looking forward to picking his brain as well and seeing what they've learned in the last 3 years. Yes, in the US, we always get things a little bit late, but there's a reason. So hopefully, there's reasons for safety and things like that, and hopefully we'll learn from the 3 years of experience that we've already had ahead of us. But people always ask me, like, why did I buy this device? So there's a lot of reasons. So why Oligio? Compared to some other competitors, it's quite painless. I would say most patients feel that it's like a 2 out of 3 pain level out of 10, and it feels like you're getting a warm, like, stone massage. It's fairly quick with the tip. You can cover the whole face and neck in less than an hour. And it's a monopolar radio frequency, and it's in the range of 6.78 megahertz. There's no foot pedal, so as you're gliding or stamping and doing the treatments, most everything is on the handpiece that you can control the power level, and then you can reach back the device to maybe add a little vibration. There's a vibration mode for comfort, things like that. So the main features, it's a radio frequency, it's monopolar, and there's a cooling mechanism. We'll talk about that a little bit. So there's a proprietary cooling mechanism. There's actually a cryo spray that goes out and sprays to cool the skin down while the treatment is going. And so you eliminate or minimize the risk of burns. And there's also a skin temperature monitoring system on there. So as you're treating, the device is measuring the temperature so that it won't allow you to deliver too much heat. And so what does monopolar RF mean? So you've got the handpiece, right? And you've got like a grounding cable that is placed usually on the back or the lower back. And so there's an electrical current that's going from the handpiece to the grounding cable. And so that's your electrical current. And then you've got basically electrical current that oscillates, and it does the bulk heating. So this is not a laser. There's no selective wavelength. There is no photothermolysis. We're basically just bulk heating the skin. And at the temperature of 40 to 60 degrees, that's what we're aiming for. So this is what's very unique to this device. So as you're treating the patient, it sprays this cryojet, and it sprays it 4 times in the one instance. So you'll see that pre-cooling, before the second pulse, before the 4th pulse, and then post-cooling. And there's also like a vibration. So similar to like your toothbrush at home, the vibration brush, it also has a vibration mode. And I think most of my patients do think that this is very helpful in terms of reducing the discomfort. And again, it's safe because it's got the skin temperature monitoring. So there's a pressure sensor, and it also won't fire unless everything's aligned, unless you're in contact with the skin and you've got the right amount of pressure and the skin is not overheated. So there is this is a misnomer, so I had to correct them, but this is actually a cooling glide solution. It's not actually oil-based, it's glycerin-based, so it's water-based. But it allows electrical coupling of the skin, reduces friction. So there's a couple of ways to do the treatment. One, we can do stamping, kind of like with microneedling, or we can glide and kind of go back and forth. And with the coupling gel here, it allows you to glide and also allows you to deliver a uniform amount of RF energy. The ultimate clinical end result is you get skin lifting and tightening, and you have to make sure you pick the right, the right clientele. I guess 30s to 50s. Someone who's like 80 years old, a grandma, really just needs like a face that they can pull their skin out to here is not going to be your ideal candidate. Your ideal candidate is the 30 to 50-year-old and mild to moderate. Some contraindications, of course, anyone that has an IED, like some sort of pacemaker, because the coupling, the radio frequency, it could affect the electrical conduction of the pacemaker. Anyone with a permanent or metallic filler, anyone with an active skin infection, and just anyone who's ill in general. If someone shows up with a fever, cough, and doesn't look well, you shouldn't be treating them. If someone has uncontrolled diabetes, pregnancy, for sure you shouldn't be treating them. Breastfeeding, I'm a little hesitant. I would probably treat someone. I don't think that's an absolute contraindication. Some precautions and warnings: people with autoimmune disease, history of keloids, unhealed skin graft, fat grafting within 6 months, and some other active infections on the wound. skin. My demographic is pretty young, actually. In my clinic, I have a lot of 20-something-year-olds. They even want to do thread lifts. So a lot of young clientele. You definitely, if they're looking for stuff to do, you definitely want to have that extra tool in the armamentarium. And again, this Oligio is really nice because it treats that younger demographic up to about 50-something. So again, really nice, V shape that's really popular in Asia to get a V line for like mild to moderate sagging, jawline contouring. Everybody wants that.
My name is Dr. Lee. I'll share with you my experiences with more of advanced use of it, and maybe I can share a couple of tips on how to use this device. The main areas where we see the aging in our skin would be the dermis, which is divided into papillary dermis and reticular dermis. The key components also changes. Using the thermal energy, we could actually generate collagen, which is wonderful for everyone. Basically, it keeps your skin tight, and it also makes sure that your skin is very youthful. So we're actually giving thermal energy to regenerate collagen and to just change the structure of the dermis, which is probably less than a millimeter. Probably I would say 0.3 to 0.7 millimeter depth, and that's the area where the aging process occurs the most. It comes with 4 steps. You apply the heat into intradermal collagen, and the contraction happens, and degeneration also happens, but it also stimulates collagen fiber production. So, and then there's a natural cleaning process that occurs, and then the long-term reconstruction happens. But brief explanation about the Oligio. They have 2 tips. One's for the face, one's more for the eye area. And the single, double auto modes, I usually use the auto mode. The laser doesn't really penetrate that deep, so it's a very effective way to use, especially the jawline area and people that have some, showing of the marionette lines. So it's a very effective area for the V-line. And for periorbital area, when I do apply Oligio, I usually use fat mounting shots along with it. I mean, we do have liposuction in our clinic as well, but these days people don't really want that downtime. They want something very fast. So you use Oligio, but in conjunction with fat mounting shots, they're going to see immediate results. Thank you.